But ultimately, in the work over the last 2 years, what we have realized or observed is that a lot of you may be experts in what you have studied, but ultimately what we are doing right now in our project and what you will be doing over the course of the next 2 to 4 years is a lot of project management related functions. So while you are expert in what you have studied, you need to be also experts in managing the project, because effectively what everybody is an extension to what Eva and myself are. You are there on the ground, you have project activities, you have initiatives agreed upon by either Eva or myself, and you have to plan, and you have to implement, and you have to monitor the progress of all these various initiatives. And that is where, over the past 2 years, that we see internally within our project, we have actually some weaknesses. So with that, that's the reason why we said let's do for this year's internal or staff building, capacity building initiative that we are project. When you hire a consultant to come in, to come for 2 weeks to do a job for us, there are a lot of stakeholders. You work with admin to do the contract, you work with logistics for the travels, you work with contracts department for their contract payments, you work with me to seek technical advice, you work with the consultants, etc. All these things, actually, that's what your terms of reference encompasses. So I just wanted to pinpoint that a lot of things are not new to you. Terminology is different. Level of detail might be also different because we don't put in things like assumptions and risks and
mandates, which would be spread over 5 months, and the list of optimistic, or if there is any delay, we're looking at least around 156 mandates, which would be spread over at least 7 months. Please do bear in mind
3.5 months, but after allowing for a lot of contingencies and work weeks, the best case scenario is about 5 months, worst case scenario 6.5. So what we're going to do is initially we start off with the pre-planning phase, which will be the budgeting and getting in touch with the sponsors and things like that. And from
And average time will be 5 months. And like what scenario is that it will take about
Fast pace, completely. And in the meantime, our second release software development started. Additionally, what we did in the training period, in the first release period, if new requirements coming, new things coming in our development team, and again that developed and do the testing phase. So it's very time. CVTR is second phase
into 10% into Balaji.
Team leader, 10%.
This is one major high-level constraint. Lack of IT skill of the existing manpower. There is almost no IT skill among the service provider. With administrative staff, besides administrative staff, most cases there is no computer skill or IT skill. And lack of timeliness of the vendors. In our vendors usually does not provide everything in time. So we have to assume this, take these high-level constraints. So stakeholder list, positive stakeholder list is hospital managers.
How we do work commitments. So we are going to present our project charter first. So first and foremost, we have called our conference first annual Mastering Social Health Insurance Project Management Conference. So the conference basically is on social health insurance and how project management tools can be used to introduce social health insurance. And the slogan of this conference is creating access without financial hardship. So we go to
the assumptions and constraints under which we are working. So, I'm sorry, there was a legend here at the bottom, but it seems to have disappeared right now. The A that you see in the bracket stands for assumptions, and the C is the constraints that we have, or we're assuming that we have.
There are some others, the BCMA Association, Labor Organization, international agencies, those are really dealing with these types of companies, garment factories, all kinds of